Imagine walking into a hospital because you need medical treatment. You're worried about your health. You're thinking about your family. You're thinking about whether you can afford the treatment. And then you make a payment. You scan a QR code. You receive the payment confirmation. You walk away believing that the money has gone to the hospital. But what if it didn't? What if the QR code you scanned wasn't the hospital's? What if money meant for a government hospital was allegedly being redirected somewhere else? And this isn't a hypothetical story. In February 2026, a financial payment discrepancy at Bengaluru's Victoria Hospital resulted in a police complaint and an FIR. The amount under investigation? Around 23.78 Indian rupees lakh. 8 outsourced workers were named in the case. But officials were careful to say something important. They had not been proven guilty. The investigation was still underway. And then, months later, another disturbing healthcare story emerged near Bengaluru. Authorities seized spurious medicines worth approximately 4.91 Indian rupees crore from an unlicensed facility near Badadi. The drugs had allegedly been repacked and relabeled to resemble expensive multinational brand medicines. Some were injectable medicines used in critical care. So tonight, we're asking a much bigger question. When something goes wrong inside healthcare, how far does the problem actually go? This is not a video declaring someone guilty. This is an investigation into what the public record actually says. Bengaluru is one of India's biggest healthcare centers. Its hospitals serve everyone from wealthy private patients to people who depend on government healthcare. And Victoria Hospital is particularly important. The Indian Express reported that the government-run hospital has more than 1,000 beds and serves thousands of patients every day, including people from economically weaker sections and neighboring states. That makes financial accountability especially important, because when money is collected inside a public hospital, the question isn't simply, where did the money go? It's, who was responsible for collecting it? What controls were in place? And how was the discrepancy discovered? Let's go back to the beginning. According to reports, the Victoria Hospital case involved payments collected through UPI at hospital counters. The issue came to light when discrepancies were noticed between what patients said they had paid and what appeared in hospital records. Some patients reportedly said they had paid digitally for laboratory services, but the hospital's records showed those bills as unpaid. Think about that. A patient says, I paid. The hospital system says, you didn't. So where did the payment go? According to the complaint reported by the Indian Express, outsourced staff responsible for collecting fees allegedly substituted the government's official QR code with personal UPI codes. The complaint covered counters including laboratory, OPD, and X-ray facilities. Police said approximately 23 Indian rupees lakh had allegedly been diverted at the time of reporting. Another report put the alleged government fund misappropriation at 23.78 Indian rupees lakh. But there is an important qualification. This was an alleged diversion. It was not a court finding that 8 people had committed the crime. A police complaint was filed by Victoria Hospital Superintendent Dr. Deepak S. The FIR was registered at Vishwaspuram Police Station on February 3, 2026, according to PTI reporting carried by the Indian Express. 8 outsourced staff members working at the relevant payment counter were named, but hospital officials themselves stressed that the individuals had not yet been proven guilty. They were being questioned as part of the investigation. That's an important distinction. A name appearing in an FIR does not equal a conviction. An investigation exists precisely because investigators still have to establish who did what, how much money was actually diverted, for how long, and who else, if anyone, was involved. And here's where the timeline becomes interesting. According to the police information reported by the Indian Express, the alleged offense at the Infosys lab counter took place between January 1st, 2025 and May 31st, 2025. But the FIR wasn't registered until February 2026. That's almost a year after the reported end of the alleged period. Why? The answer reported by hospital authorities involves administrative procedures. Dr. Kavya S.D., Director cum Dean of Bangalore Medical College and Research Institute, said the alleged fraud began before she assumed charge in late August 2024 and that administrative procedures contributed to a delay of several months before the FIR. The timeline raises legitimate questions about internal controls. But again, a delay does not automatically prove a cover-up. The reasons for the delay should be examined through the hospital's records and investigation. And there's another question. Was 23.78 Indian rupees like the full amount? At the time of reporting, hospital authorities suspected that the actual amount could be higher. An internal committee had been formed to audit recent financial transactions, and authorities had not yet identified exactly which counters among the reported payment points were involved. So the investigation wasn't simply, who took 23 Indian rupees lakh? It was also, what is the full extent of the discrepancy? This is where the story becomes bigger than 8 names. Digital payments are supposed to make transactions easier to track. Every payment leaves a digital trail. So if a hospital's official QR code is replaced by another QR code, there should theoretically be a mismatch. Patient payment, UPI account, hospital billing system, bank reconciliation. These systems should eventually meet. And when they don't, someone should notice. In this case, according to the reports, discrepancies were eventually noticed. But the important question for a public institution is, how quickly and how many transactions can pass through before the system catches the problem? Now we move from money to something far more dangerous. Medicine. On August 18, 2026, Karnataka's Food Safety and Drug Administration Drug Wing conducted a raid near the Badadi toll gate. Authorities seized spurious pharmaceutical products valued at approximately 4.91 Indian rupees crore from an unlicensed facility. According to authorities, the operation involved repacking and relabeling cheaper medicines to make them appear to be expensive multinational brand products. The reported seizure included thousands of vials. Among them were 5,640 vials of Cefiavigent 2.5 and 1,531 vials of Hislam injectables, along with expired medicines, filling machinery, labels, and packaging material, according to the Karnataka Health Minister's account reported by the Times of India. Authorities allege that lower-cost medicines were sourced from other states and then relabeled to resemble expensive imported or multinational brand products. The facility itself was reportedly operating without a valid license. And now comes the most disturbing part. Authorities were investigating whether some of these medicines had entered hospitals and pharmacies. Karnataka Health Minister UT Kader said some of the relabeled medicines may have been supplied to hospitals and pharmacies in Karnataka. He also said some may have been used in ICUs. But listen carefully. That was an allegation under investigation, not a finding that patients in a particular Bengaluru hospital received these drugs. Samples of the seized medicines were sent for laboratory testing to examine their chemical composition, sterility, and potency. That testing matters, because a medicine being illegally relabeled is already a serious offense. But determining exactly what was inside the vial and where it went requires evidence. And this part almost sounds like a crime documentary. According to the Times of India, the investigation began after agricultural laborers noticed what appeared to be medical waste being dumped near a stockhouse. One laborer told a police constable. The constable investigated. Samples were collected, and investigators eventually discovered that the building was being used for unauthorized medicine-related activity. What looked like waste became a clue, and that clue led investigators to a much larger alleged operation. Investigators alleged that cheaper, spurious medicines were being sourced from places including Himachal Pradesh and Telangana, and then repackaged near Bengaluru. For people who have been arrested by August 21st reporting, while the alleged mastermind was said to be outside India, authorities were trying to establish the network. Suppliers, transporters, agents, middlemen, pharmacies, hospitals, and ultimately, patients. On August 20th, the Karnataka government announced a 6-member special investigation team to investigate the racket. These two cases are not the same. There is currently no basis to claim that the Victoria Hospital payment case and the Badadi fake drug racket are connected. They involve different investigations, different alleged conduct, Different people, different evidence, but they raise the same fundamental question. How strong are the systems designed to protect patients? In one case, investigators were examining whether hospital payments were allegedly redirected. In another, authorities were investigating whether fake medicines entered legitimate healthcare channels. We know that a police case was registered over an alleged Indian rupee 3.78 lakh payment diversion at Victoria Hospital. We know 8 outsourced workers were named in the FR. We know authorities said those individuals had not been proven guilty. We know an internal audit was conducted. We know that on August 18, 2026, authorities seized approximately 4.91 Indian rupees crore worth of suspected spurious medicines near Badai. We know the facility was reportedly unlicensed. We know authorities allege the medicines have been repacked and relabeled. Whether the Victoria Hospital amount was larger, whether anyone beyond those named was involved, where the counterfeit medicines were distributed, whether any reached hospitals, whether any patients received them, and if they did, what happened next? A hospital is supposed to be one of the places where you are most protected. You enter because you're vulnerable. You trust the doctor. You trust the nurse. You trust the pharmacy. You trust the billing counter. And most importantly, you trust the system. But trust isn't created by a signboard. It isn't created by a government logo. It isn't created by a QR code. Trust comes from accountability, from audits, from transparent systems, from investigations when something goes wrong, and from consequences when wrongdoing is actually proven. The Victoria Hospital case is still an investigation. The Badati drug case is still an investigation. So we won't decide the verdict from a YouTube video. The evidence will decide it. Because when you're talking about healthcare, money can be recovered, reputations can be repaired. But when a patient's health is involved, there may not always be a second chance.